Hi, this is Dr. Mary Barbera, autism mom, board certified behavior analyst, and registered nurse. Today, I'd like to talk to you about PANDAS and PANS and how it might relate to children with autism. Back in June of 2004, Lukas was 6 years old, and he has moderate to severe autism, and all of a sudden, he woke up one morning and he had motor tics. So the first day I noticed it, it was really abrupt and very acute onset. So he started, flipping his shoulder and making a sound. And the next day, it was even worse. The sound was louder. He was going, "Neh, neh," and I was unsure what was going on. It was very, like I said, abrupt. So as the days progressed that week, it got worse and worse, and he even had some aggression, which was very atypical for him. I think he bit someone that week, and the last time he had bitten anybody was at age 2. As both a registered nurse and a behavior analyst, I decided that I needed to know, first of all, what the rate was, and also if this was a behavioral problem or a medical problem. I had Lukas's ABA therapist take a clicker like this, and every time he had some kind of motor tic, I had her click. We were also trying to determine if any parts of the day resulted in more tics than others. What we found over the course of just a few days is that the one day he had 500 tics in total, and the next day, for a different amount of time, he had 400 and something. And then we divided those by the number of minutes where the therapist was clicking. And it was really strange because over 2 days, he averaged 1.37 a minute over both days, which was so strange. Because some minutes he'd have 4 tics and some minutes he'd have, less, not even 1. And it was just so strange that it all equaled out to 1.37. Anyway, I decided to go to Google and start Googling acute onset tics. And what I found was a disorder called PANDAS, Pediatric Autoimmune Neuropsychiatric Disorder Associated with Strep. At the same time, I noticed that Lukas had it looked like open mosquito bites, like almost infected lesions on his legs. I didn't know where they came from. No one else in our family had mosquito bites or infected, lesions on their legs. But we decided that we would treat Lukas for the tics and for the open lesions on the legs, which may or may not be related at that point. I had no idea. But within 5 days of taking an antibiotic once a day, his tics went from 500 a day to 0, and his lesions on his legs also cleared up. I continued to learn about PANDAS because that wasn't the last time that Lukas got tics. In fact, every couple months, Lukas would have a bout of tics that we would treat with antibiotics. And over the years, he was treated many times, which, looking back, that's not really what you should do, because if someone has PANDAS, you shouldn't be just treating them episodically. But I didn't know, and it took until age 14 when Lukas was actually diagnosed with PANS. Now, the change from PANDAS to PANS is Pediatric Autoimmune Neuropsychiatric Syndrome, because over those years, from the time when Lukas was diagnosed, or Lukas had symptoms till when he was diagnosed, they changed it because they realized that it wasn't just strep that was the infection that was causing these neuropsychiatric syndromes, but it could be mycoplasma, it could be Lyme, it could be staph infection, which I would hypothesize that probably a skin infection would be more staph related. But in the end, what I learned was that there are a ton of kids that have neuropsychiatric syndromes and they are related to bacterial infections. And this is not a behavior you can treat with ABA. It's a behavior that must be treated medically. I'm going to tell you about several of my clients had symptoms of PANDAS too, and one of the clients that really sticks in my mind was Matt. He was in a verbal behavior project classroom, and I had known Matt for years. He had more language than Lukas, and he was doing pretty well in general until the day that I got an email saying that Matt was out of control. He was aggressive. He even peed in the corner of a classroom, and this child was like 10 years old and had been potty trained for years. They were even thinking that they might need to find an alternative placement for him. I was scheduled to go in the next day, and when I went in and just looked at Matt, all of a sudden I realized that Matt had PANDAS. Matt had tics that included severe rapid eye blinking like this. He also had throat clearing. So I got out my clicker, I clicked eye blinking, and I tallied throat clearing, and what I found was a very high rate of eye blinking. I could only keep track for 10 minutes because it was so high. We called the parent. Parent took the Matt to the doctor, and he was put on antibiotics, and that all cleared up. So there are two great books that I want to recommend that have helped me figure out more about PANDAS. One is a book called Saving Sammy, A Mother's Fight to Cure Her Son's OCD by Beth Allison Maloney. And Beth also wrote a second book called Childhood Interrupted, which is really more of a textbook about the symptoms, the treatment. This is more of a story how Beth healed her son, who was typically developing. So you don't have to have autism to come down with PANDAS. In fact, it's often more dramatic in typically developing kids. All of a sudden, they have acute onset OCD or acute onset tics. And they could have other symptoms like depression, anxiety. I do believe that many children, both with and without autism, who have an acute mental health issue should be treated or assessed for a bacterial infection that could be causing this. There's a great website called pandasnetwork.org that I would highly recommend. And for you professionals out there, just be on the lookout, because this is a rapidly increasing disorder that affects both children with special needs and without special needs. And we should all be a lot more aware of that. Thanks for watching, and I'll see you next week.